Crazy, right? As a high earner in Germany, you are paying nearly 1,200 euro every month into public health insurance. But are you really getting the care you deserve? Let's be honest, when you pay that much money into your healthcare system every month, you expect world-class care, don't you? But what happens when you actually need help? Your MRI appointment in 5 months. Sounds absurd, right? Well, welcome to the German healthcare system. Hi, I'm Natalia Shevchenko, independent financial advisor. For over 12 years, I've been helping successful professionals and executives in Germany build real financial security. And I don't just talk about money. I develop comprehensive strategies for health, wealth, and real estate that actually work together. On my channel, you get honest, independent insights into the world of finance every week. No sales pressure, no sugar-coated promises. Just the truth that helps you make better decisions. In this video, I'll walk you through the 5 crucial differences between public and private health insurance and why these differences could literally impact your health, finances, and quality of life. Let's start with probably the most frustrating issue: getting a medical appointment. Imagine this. You've got severe back pain. You need an MRI. You call the clinic, and as a public patient, the next appointment is in 4 months. That's exactly what happened to my assistant Susanna. Her husband could barely walk. The doctor said, "We are fully booked until summer." So he spent 4 months at home, in pain, on painkillers, unable to walk. 4 months of uncertainty, 4 months of lost quality of life. And this isn't an isolated case. On average, public patients wait 2 months longer to see specialists than private ones. But why is this happening? The answer is simple. It's about money. A general practitioner receives just around 23 euro per quarter for each public patient, whenever you come once or 10 times. A dermatologist, just 14 euro per quarter, also independently on the quantity of your visits. Can you imagine why so many practices say, "Sorry, we are not taking new public patients right now"? As a private patient, it's completely different. One phone call and you often get an appointment the same or the next day. And the doctor can bill all their services fairly. It's a win-win situation. The second major difference is treatment scope, meaning what actually gets paid for. In public health insurance, you get services that are sufficient, appropriate, and economical. Sounds reasonable at first, right? But let me explain what this means in reality. Imagine your uncle has cancer. He needs strong painkillers to manage daily life. The original medication helps him. It takes away his pain, he can sleep, again, eat, move around. But the public insurance says, "We won't pay for that. There is a cheaper option," and he gets the generic version. Cheaper, but often less effective. The pain returns, he barely sleeps, eats less, loses weight. His quality of life drops drastically, just because the insurance wants to save money on him. And it gets worse when it comes to actual treatment. For many types of cancer, public insurance first prescribes the cheapest standard therapy. Only when this provably doesn't work, meaning when the tumor continues growing, the next, often more effective treatment can be tried. In private health insurance, it's completely different. Here, all medically necessary measures are paid for immediately. It's not about what's cheapest, but what helps you best. You get the most modern, effective, and medically sensible therapy right away. And I know this might sound cynical, but this is reality. As a publicly insured cancer patient, you first have to prove you're survivable enough before better treatments get approved later for you. With private insurance, you get them directly. The third point is doctor choice, and this is where it gets really interesting. As a publicly insured patient, you can only go to doctors with public insurance authorization. But many specialists work exclusively private because they can provide better medicine and treatments that way. We have over 600 private clinics in Germany. These have often become highly specialized and offer world-class medicine. Here's a concrete example. The Martini Clinic in Hamburg is a world leader in prostate cancer operations. They achieve a 93% continence rate for their patients after surgery. The national average is only 56%. Even more impressive, 75% of men treated at the Martini Clinic fully regain their sexual function within 1 year by the latest. In the public system, that number is below 30%. We are not speaking about luxury here. This is quality of life. Let's move to the fourth difference: hospital treatment. In public health insurance, you end up in a shared room with a doctor on duty at the nearest hospital. Plus, you pay 10 euros per day out of your own pocket, up to 28 days per year. With private health insurance, it looks completely different. You have a single or double room, you have free choice of hospitals throughout Germany or even across Europe, including private or specialized clinics, and you are treated by the chief physician. You can choose the doctor you trust, not whoever happens to be on duty. And you know what? This isn't just comfort. When you are sick, you need rest, you need trust in your doctor. You need the feeling that everything possible is being done to make you healthy again. That's simply different with a specialized and experienced doctor who takes time for you than with a stressed assistant doctor on duty. The fifth and final point is additional benefits. Here you can see clearly from typical life situations where public insurance has its limits. For instance, public insurance doesn't pay for vision aids, except for severe visual impairments. Laser eye surgery, forget it. Alternative practitioners, no. Modern treatments, no. They're not economical. Private health insurance regularly covers all of this. Comprehensive dental benefits, including implants, inlays, root treatments, etc., instead of just fixed subsidies. Alternative practitioners and alternative treatments are also mostly covered. The difference is especially brutal with dental care. In public insurance, you get fixed subsidies. That's 60 to 75% of the simplest care. And trust me, you really don't want to have that. So if you want something better, you pay the rest yourself. For an implant, you can quickly pay 3,000 to 5,000 euro out of your own pocket. With private health insurance, no problem. 80% to 100% reimbursement, depending on your plan and the services. Now you might be wondering, Natalia, this all sounds great, but can I afford it? And am I even eligible? I can't answer this question generally, because every situation is different. But what I can tell you, these 5 differences can determine the quality of your life, or even your life itself, in an emergency. Imagine you are 50, you have a family, a successful career, and suddenly you receive a diagnosis. Do you want to wait 4 months or be treated immediately? Do you want standard treatment or the best available medicine for you? I know these are hard questions, but that's exactly why it's so important that you make an informed decision before it's too late. If you want to know whether private health insurance is possible and sensible for you, I have 2 offers for you. First, sign up for my free webinar or watch the recording from the last event. There I explain exactly who can switch, what it costs, and what you need to watch out for. The links are in the description. Or second, book a free initial consultation directly with me. We'll look at your personal situation, completely non-binding and without sales pressure. This link is also in the description. Your health is the most important thing you have. Invest 15 minutes to find out how you can protect it optimally. If this video helped you, please give me a thumbs up and subscribe to my channel for more honest insight into the German healthcare system. Your health, your wealth, your future. I'm Natalia. See you in the next video and take good care of yourself.